Assalamu alaikum to all our listeners out there. You are tuned into InspireFM, and I am absolutely delighted to welcome you all in another exciting special edition of the Health Week of Health and Fitness Show. I'm your host Fahad Matin, and I hope and pray that the day has been gone very good for you all. I must say that this is a part of our health and fitness broadcast, which we are doing as a part of Health Week on InspireFM. This program is broadcasting live today on 21st of April and casting its positive vibes to all our lovely people in Luton. Our positive airways are also covering neighbourhood areas like Harpington, Bedford, and all the surrounding areas of Luton. As you know, as I said earlier, that on InspireFM we are doing this special health broadcast throughout this week, covering a different topic every day. So on Monday, which was my show, Health and Fitness Show, we have talked about diabetes, and we have enlightened you with all the problems and things and the cures about diabetes, as in what are the prevention methods you have to look after. On Tuesday, we have talked about mental health. On Wednesday, we have talked about gynecology. And tomorrow, we will be talking about better together in a social prescription and social way. But today, we are talking about the most important topic, a very, very important topic in most of the parents' life, which is the child health and well-being. Yes, you have heard me correctly. The topic of today is child health and well-being. Although every single time I have started my show with a saying, but today I will say children are the best gift from Almighty Allah. And on this note, I must say, if you'd like to give us a call, or I know some of you may have some burning questions, please give us a call on 01582 481822, or you can send us your text messages and WhatsApp on the number 07779 481822. I repeat, 07779 481822. Now, today again, I have the utmost pleasure of having a lovely guest today with me, and I will ask my guests to introduce themselves. The guests for me tonight are Dr. Beryl and Dr. Anita Ray-Chowadhury. Good evening, ladies.
Good evening.
Why don't I let you guys introduce yourself and give us a brief intro about yourself as well?
My name's Dr. Anita Ray-Chowadhury. I'm a GP and was a pediatrician many moons ago as well. I also work with the Luton CCG, and I'll hand it over to my colleague.
I'm Beryl Adler, Pediatrician at Luton and Dunstable, where I've been a consultant for 20 years. And I also had a brief period during my training as a GP, which allowed me to know what children are like when they're going to their GP surgery and not necessarily needing to come to hospital. And I really enjoy looking after children in hospital, but also working with my colleagues, GPs and nurses and health visitors outside the hospital, to make sure that together we keep children healthy.
Wow. And again, thank you so much for coming to our show tonight, and let me officially welcome you to a lovely program.
It's great to be invited.
Thank you.
Now, let's talk about the kids itself. And I know, Anita, thank you so much for the lovely short talk this morning, and it was a very good talk I've heard as well, and we have received a very good reviews in the morning show. So let's take it on from the same portion where we have started this morning. Like, what are the common reasons parents like us who, because I'm a parent as well, there are times when my child is not well and it is discomfort for me. I normally take my child to hospital, or I go to GP surgery. But what are the common reasons you have seen parents take their children to either hospital or GP?
So if I do general practice first, so I think there's a variety of reasons. We get a lot of parents who are sort of first-time parents, so who might come in with colic or understanding their child when they're crying. They might come in with rashes or breathing disorders. So when I mean breathing, I mean sort of congestion. So they might come in with a blocked nose, a cough. Sometimes they might come because they've got a fever, and knowing what to do with the fever, and mainly it's those kind of things, seeking reassurance and advice, and knowing where to go with those concerns. I might pass it on to my colleague Beryl just to talk about a little bit about secondary care.
So we know that most unwell children are looked after very nicely in GP surgeries and out of the hospital, and often actually by parents giving basic parent care and attention at home, and just seeking help and advice when they're worried. And we know that when children go to the GP surgeries, that the children, the babies and children, will be looked at and examined, and if a GP or a practice nurse or a health professional is worried that a child might be more unwell and might need additional treatment that can't be provided by the GP and practice nurses, then they may ask the hospital and the paediatric department to see the child if they're becoming more seriously unwell. But actually, we know that the vast majority of children don't need to come to hospital for ordinary illnesses, so that we reserve hospital and the facilities and for the seriously sick child. We also see children sometimes in clinics when the GPs feel that there might be something a little bit more unusual going on, and they want a paediatric opinion. But we work very closely with our health partners so that we can see the right children in hospital that really do need that different level of care.
One of the things I just wanted to point out was in primary care, I think a lot of the time maybe the parents might not know other resources to go to other than their GP and obviously the hospital doctor, and there are so many other resources out there actually, and especially when you're a first time mum and not knowing really what's the right thing to do for your child, and obviously that's the most precious thing to you, and it's really important that we do the right thing. And so seeking advice from health visitors, children's centres, and if necessary, depending on the age of your child, a school nurse are really important. Pharmacies are also actually very important, so the pharmacist can also give you advice. We always encourage, obviously, if your child's not in an emergency, to try and seek advice from those resources and obviously from your family doctor.
Now, sometimes most parents nowadays, because they're in their second generation, third generation in this country, they are very knowledgeable, and they know when their child is seriously ill and when their child is not seriously ill because of good information out there. They know what's going on. Sometimes they know that it's normal thing, not a big thing, not a big deal. But sometimes parents do get concerned for certain things, and they know that it's not appropriate to take the child to hospital. Either it will be a too long wait and they will just give you a basic words and then they will turn you back. Same thing goes with GP surgery sometimes. So in those circumstances, parents, what do you advise for the parents? Because you are a mother yourself, what's the best course of action to take just to get a basic advice?
Okay, so being a mother of a 1-year-old child, I'm very much in that position. And even if you're a healthcare professional and so forth, you're still a mother.
Yeah.
You know, and then when it comes to your own child, you are a mother and you have the similar anxieties as other mothers. And I actually seek the advice of my health visitor a lot of the times. You can, they usually give you their telephone number, or you can access them at the children's centres. And they're actually really, they're far more specialised at those common things that little children say. I think the other thing I need to mention to our listeners is 111, and I mentioned it this morning, and following on from that discussion, is that 111 is a number that you can call, and it's not just for emergencies, it is for advice as well. So you're talking to a human being who can actually discuss with you what your concerns about, and then they will actually help direct you appropriately to what you would need, and that's 24/7, so you can phone them at any time.
Right.
There's a few things also that are helpful about keeping your children healthy, and the health visitors are particularly expert at that, and there are also family workers in family centres who've got a lot of expertise and can offer advice on things like infant feeding, on immunisation, on the vitamins that are really good for keeping children healthy, and also on healthy lifestyle. The other thing I would mention is that some children are on regular medication, and that can be quite difficult to remember. Even those of us who are doctors can learn with our own children how difficult it is to remember to give regular medication. But it's really important, and it's also important if your child is on regular medication that you always make sure that you've got a supply of that medication and don't run out of it. And that's the sort of thing that we sometimes see, that when families have run out of medication, that children do become ill. So do make sure that if you're on regular medication from your doctor, that you always have a backup supply.
Yeah.
Right. So when you said regular medication, what medications you're referring with regular medications?
Well, for example, children who have wheezing may be on inhalers, or there are some children who have to take medication to stop them having seizures. There are all sorts of medication which really vary depending on what long-term condition your child has. Although, of course, many children go through childhood hardly needing any medication at all.
Yeah, and sometimes they can grow out of things as well. So
Grow out? How?
So sometimes, so you can have children who might have some breathing issues when they're younger. And that could be allergy related, or it could be just quite mild breathing disorders. And we might as GPs give them a trial of inhalers. That doesn't necessarily mean that they have asthma, but they might actually just need those inhalers for various other reasons because of their symptoms. And when I say grow out, is that obviously their bodies develop, and their airways improve, they enlarge, and so in a very loose term, we mean growing out of it in the sense that they might not need the medications anymore. And it's all, it's very much dependent on the child. Obviously, healthy living is very important. So,
Anita, I'd add to that and say to you that seeing many children in infancy and toddler age group who do wheeze, particularly when they've got a viral cold, an awful lot of those children, by the time they're school age, have actually grown out of their wheezing. A small proportion of children will actually go on and actually have asthma as a long-term condition, but we see an awful lot of small infants and children who do wheeze in the early years, but the good news is that they will often outgrow it.
Now, in early ages, especially between 6 months and so forth, one of the common problems which small child has is a colic problem. Now, what's the best thing to do if a child is having a colic problem?
That's a very interesting question. We were actually just discussing that before the radio show, because to be honest with you, as a mother, you sort of go to your pharmacy or you go to the supermarket and you're faced with an entire row of different so-called medications or drugs and so forth that you can take, and it becomes quite confusing. I mean, what's the right thing? Should I be giving this to my child or not? And actually, colic is it's quite a normal part of growing up, and it's probably more discomfort. So I would advise actually to use health visitors. My health visitor has been amazing in guiding me to positioning, feeding, sort of like holding my child after I feed, letting them, winding them. So there's lots of other things that you can do before you even think about the lines of, which medication should I choose. And I would personally say I don't think there's any one of them that works best. That's probably why there is a whole load of them. And that's probably why I would actually seek advice from people like my health visitor. You can also go to NHS Choice, as I mentioned it in the morning. It's an online sort of NHS supported website. And it gives you sort of simple tools to use with your child first. I mean, I don't think any of us as mothers, we want to give our children medication unnecessarily. So we want to try and do all the other necessary measures to help them. And they grow out of it. So it's just distressing sometimes to see them like that. But there are lots of things you can do.
And Anita, I'd agree with you completely. And actually, I mean, we've, all of us who've had babies have actually worried sometimes when they are uncomfortable, and we need to look at a little bit about the feeding and whether the volume that we're giving is right, and tips on feeding, and the health visitors are very good at that. Between the GP and the health visitors, they're usually able to identify the child who is a worry.
Yeah.
And the child who is a worry is a child who's actually poorly, not gaining weight, having lots and lots of vomiting, or having really a lot of difficulty with pooing, and those are the children that the GP and the health visitor will write to us in the hospital and ask us to see and ask us to offer additional advice. Sometimes families get very confused by lots of different advice about what to do about different formula feeds and whether to change them, whether to have medication. Sometimes it's useful to do, if a baby's otherwise well and can be comforted, to actually just wait and see how the symptom is going. Obviously, we'd like to see children where they are severely distressed.
Yeah, and I think where parents might feel that we're not doing anything, in the sense we're not giving them a medicine or something like that, it's because we're actually looking for any other signs that might be significant. As my colleague said, if we notice that they're losing weight or they're distressed but by the large amounts of vomiting, it's looking at the child, not just looking at the problem.
Now, because you have a year-old child,
yes.
So you're the best person to scope this question. Is this common to all child, or is it specific to certain childs, and certain childs don't show any symptoms?
I mean, to be honest with you, I think it's very, very common. Whether it's identified in that way, we worry about it being something else, but I think it's very common. But just because of the way that developmentally, I think that's why it's common. But they do grow out of it. I mean, my son had colic, and I didn't actually use any medicine. I used the advice of positioning and feeding, and he did grow out of it. Many sleepless nights, but he did grow out of it. But yes, I think it's a very common thing, and that's probably why I think, especially when you're a first-time mum or when you're just a new mum, it's quite important to ask those kind of questions, so you kind of are prepared for what's potentially to come and how to recognise it.
And we're always willing to see that small group of children in whom the problem is more severe and is persistent, and there are ongoing worries.
Right. You are tuned into Inspire FM, and today we are talking about child health and well-being on the special health broadcast of Health and Fitness. If you have any questions or queries, you can give us a call on 01582 481822, or you can text us or WhatsApp us or your questions on 07779 481822. One of the questions just popped on the screen, and it says, "Hi, my 3-year-old son is catching cold in every few days. Could it be allergic, or is it something which is causing this reoccurrence cold?"
Well, actually, that would be a good question for both of us, because Beryl has a lot of experience on allergies. But if I speak from a general practitioner perspective, and I mentioned it this morning, it's very common for children to get coughs and colds, and they can get up to 20 coughs and colds in a year, and it's quite common. I mean, I've got a 6-year-old son as well, and he gets one after the other, and you kind of think, especially over the winter period, when is this actually going to end? And I think recognising what's the difference between cough and a cold and an allergy. Especially with allergies, you still get the congestion, but you get more sneezing, and you might get other associated not illnesses but signs with it. So you might get some eczema or signs on your skin. So I wouldn't worry about it if the child is developing well, the child's well in themselves, there's no high fevers, and there's no other concerns. Actually, it's quite common, and having those kind of illnesses one after the other, as long as they're well throughout it, then actually it's part of them building up their immunity. I think what would be quite good is maybe Beryl talking about those small selective group where sadly it's signs that it might be something else.
Well, I think, Anita said very much the background that for most children, having recurrent coughs and colds is part of normal at toddler age, and that's particularly the case if children have got older brothers and sisters at school who are exposed to respiratory viruses, and also if they're at nurseries or in childcare. And the good side about that is that it does enable them to build up immunity, and that's how we develop immunity and are able to fight infections. Again, the role of the paediatrician is to recognise, and the GP to ask us to see children where there are indicators that the child's got something a little bit more wrong with them. Again, there would be signs for us, and that is children who are having respiratory infections which are actually severe and making them significantly unwell, children who are actually needing to come into hospital because they're so unwell. And as far as allergy is concerned, there's a very small group of children who quite obviously are running into allergic problems, and they're often the children who have significant eczema in the early years, and then become frequent wheezers and may have a bit of hay fever. But for most children, these illnesses are mild, self-limiting, and don't need special tests or special treatment.
I have another question on my screen. Well, that's good. That's good that people are listening to us. The question says, after starting the formula milk, constipation is major problem for my infant. So what shall I do?
Okay, so in general practice, constipation is a very common thing parents come in with. I think one is understanding what do you mean by constipation. So there are various degrees of constipation. Some parents will just say it's constipation because they used to poo every day and now they only do it every few days. So it's that. Is it causing distress to the child? Are they in discomfort? Are they in pain? Looking at other things that they might do. So, sorry, what was the age of was there any age? No.
It says problem for my infant.
Okay. So sometimes also drinking water, drinking other fluids can also help. In the past, we used to even promote with water a little bit of prune juice. But I think it's also looking at the child as a whole, because definition of constipation is very variable. In extreme cases, we might recommend medications, but we really try not to go towards medications, especially when they're very small. If you talk to your health visitor, they can give you other things that you can do, especially if the child's not passing stools as frequently and causing them discomfort. So there's massaging, there's obviously bringing your baby's knees up to their stomach, and that helps the digestive system, just helps it going. I think the point that you've made is a change in feed, and that is quite common. When you do change the type of feed, it can affect their digestive system, so it can go in two directions. So it can go loose or it can go more constipated. It is a common problem, but I think it's recognizing when it's serious and when it's the other measures you can do. So I would try the others first, either massaging the legs up to the knees, looking at the child, are they in discomfort, trying the fluids. I think recognizing that when it's more serious, we would then go down to the medications, but we would probably seek advice as well and discussion with our secondary care colleagues, especially when it's a very small baby.
By the way, how old is your child, sister? I presume it's a sister because there's no name mentioned. But how old is your child, and what's the current age of the child? So it will give us a guidance. It will give us a better way of understanding the symptoms. I remember when my child was young, the health visitor who we saw, she asked us to give pure orange juice. So you have to literally few drops of orange juice will help ease the constipation, and it did help, to be honest. But then again, it was something which she has told us, so we've tried and it did work.
I mean, health visitors are marvelous at sort of knowledge that I would be honest with you, they're experts in this kind of area, and it's always recognizing your first resources and asking them advice.
I would agree with that. I'd also comment that actually it's very normal for a baby moving from breastfed to formula to go from actually having to have more solid a poo, which can appear to be constipation. So that's quite a normal change, that a breastfed baby will tend to have more and softer poos than a bottle fed baby. And again, it's about looking at whether the baby has any associated symptoms and is uncomfortable and actually really isn't passing enough nappies and is struggling. And lots of people are worried that their baby may be on the wrong formula, and we do see children who are changed onto different formula feeds. The health visitors will often give advice and will seek the advice of dietitians, and where necessary, a small number of children will need to be seen by paediatricians to see whether there is a problem with ordinary formula. But that number is a very small number, and most babies will settle down.
I think the reason I was asking about the age as well was because obviously if they're at an age which is 6 months and above and they're eating, then obviously you can use other things, high fibre and other enhancements in their food.
I'll hold the thought over there, and I will definitely come back after this break, because it is time for our break. Yes, the first half has just passed. So all our listeners, please do not go anywhere. We will be right back after these short messages. Assalamu alaikum.
Radio for the community, by the community. You're listening to Inspire on 105.1 FM.
Assalamu alaikum to all our listeners. You are tuned into Inspire FM, and I welcome back to our special health broadcast of the Health and Fitness Show. I'm your host Fahad Matin, and today we are talking about child health and well-being with our two lovely guests, Dr. Anita Ray-Chowadhury and Dr. Beryl
Adler.
Adler. Sorry, I forgot your last name.
That's fine.
Thank you so much, ladies, for coming in for our show, and I welcome you back as well. Now, before we went on break, we were talking about constipation and the problems which babies are feeling. I have another question. During the break, I have a couple of questions as well. By the way, the child which we're talking about was 4 months old. Now, there's another question popped up on the screen, and it says, my baby is 3.5 months old, and she's having dandruff on her head. So do tell me how to get rid of it. But before we go for the answer, for all our listeners who are just tuned in, we are talking about child health and well-being. So if you have any questions and queries regarding our topic today, please give us a call on 01582 481822 or send us your text messages or WhatsApp on 07779 481822. Right. So please enlighten us with the reply.
So actually, we were just discussing this in the break. So I mentioned that I had a 1-year-old baby, and he also had what seemed to be dry skin on his scalp. Obviously, I'll give you. We can discuss this topic, but obviously, without seeing the child, I can only give you general advice. I would always encourage you to see your health visitor or your GP as you see appropriate. But if it is what I think it is, which is you get this dry, flaky skin on their scalp, and as a parent, you think, "Oh gosh, they look awful with this," and is it going to cause any serious problems? Well, quite frankly, no. With my son, we just left it, and actually he naturally will grow out of it. If you're concerned about it because, one, it might be distressing the child, or they might be scratching it quite a lot, there are a few things you can do. So before they used to say put olive oil on it, and sort of that would help moisturize it. I would actually recommend, your health visitor might have some other advice on it, or you can also go to your pharmacist. They might have some new treatments which are available. In all honesty, it doesn't need to be treated. It is more that we treat it because it doesn't look so nice. Obviously, if there are any signs of infection, which would mean that it's red, angry and hot to touch, that's different, and we would definitely want to see that and potentially treat that. But if it's just dry skin, I would just encourage you a little bit of olive oil, and you can just massage it into their scalp, or you can just leave it and it will go.
And yes, indeed, listeners, all the advice which we are giving on this show is completely generic. So if you have a specific condition on of your child, or you want to discuss in detail, you can go to your GP or use the services of 111, because they can, where you can explain them the whole symptoms and signs, and they can give you advice as in what's the best course of action to do.
The other useful thing sometimes is if you're worried about a particular symptom or some spots or in your child, is that you can actually look up on NHS Choices.
Yes.
And there are some very nice information sheets, often with photos, which actually illustrate what certain conditions look like. You should never use that as a substitute for getting your child looked at if you're worried about your child's well-being at the time. If your child's actually very unwell, but it can be useful to help you learn more about common childhood conditions. And we find it a very useful resource to get information sheets to give to parents in surgeries and in outpatients. Anita, have you found this useful too?
Yes, we do. We certainly deter our patients from just pressing a few things on Google search and recommending sites like this, because it gives you very clear, specific information. But we usually give it after they've sort of spoken to us and guide them accordingly. Yeah.
Another question popped up. It's good that we are getting questions today. My child complains for pain in his leg, and sometimes he is so much in pain that even a painkiller medicine doesn't help to relieve. Can I massage anything on his legs?
I think, first of all, thank you very much for asking us the question. It is a little bit vague, so without asking maybe a little bit more information, it's a little bit difficult for us to give a clear response. But if I sort of use the topic of children who do get aches and pains in their joints, and we sort of think, oh, they're very young to get aches and pains. As long as there's no serious inflammation of the joints and there's no signs of infection, which we mean swelling, hot to touch, and a serious pain, they are naturally usually just growing pains. They can sometimes get them at night, and that's quite distressing for the child and both for the parent, because obviously it's keeping the parent awake. And sometimes you might not find that paracetamol would work, and as long as we don't have the other sinister signs of infections or anything else going on in the joints, sometimes they can just be growing pains. Obviously, talking about massaging, if we're talking about just massaging to relieve the discomfort for the child, you can massage. Depends on the child's age, and obviously there are medications you can massage, or you can just simply do the action of massaging.
So what about things like ibuprofen gel or diclofenac gel or something like that? Can
it really depends on the child, because one, I wouldn't want to use those kind of medications because they can affect the child's stomach as well as an adult. So one, I would be reassured, actually seek medical advice just to check that obviously, what is causing the discomfort. If it's just growing pains, if there's anything else, obviously if they've had any family history that they're worried about something else. Now, if they're reassured that it is literally just growing pains, I would seek advice from your GP if you would use any of those kind of strong medications, because they can cause obviously side effects.
So I know that most of the children who have odd aches and pains that sort of settle are seen in general practice and don't need to see a paediatrician. We do need to see children who have a big change and are limping or not weight bearing, or develop a swelling of their joint, or a sort of a hot joint, particularly if they haven't got any history of having hurt themselves at all. So as long as things settle down, this is normally not a big problem. But if an individual child is having a new problem that's repeatedly causing them difficulty, then those are the children who should be checked.
So
by your GP.
So the bottom line is, if the child is running around, happy, hopping, jumping, and says yes, the pain is there, it is quite possibly the growing up pain.
Yeah.
But if the child starts showing the symptoms of lethargicness and restricted movement due to the pain in the legs, the best thing to do is to go to GP, and then
they can assess them,
and then quite possibly they can refer it to the
if needed. And sometimes you might find that that's fine as well. So it's obviously seeking that clinical guidance.
Right. In terms of the vaccination, now it is one of those things which most parents do take their kids on. Some parents don't take their kids on. So what's the importance of vaccination, having vaccination, or not having vaccination? Getting the vaccination for your child, or taking them for the vaccination?
Yes. So obviously my children have actually been through their vaccination and the vaccination program. And I think probably for us as parents to understand why was vaccination provision even offered to us, and that's because it's helping us prevent and at least decrease the risk of having some potentially serious illnesses. And although measles, mumps can present themselves as mild things such as a rash and so forth, but it can also be very sinister, and you can never predict how your child would present and get the illnesses if you don't take the vaccine. And sadly, we have seen a rise and some quite a few fatalities because children have not been taking the vaccine and sadly been getting the diseases. So as a parent, I would definitely advocate, understand why we want parents to make the decision to promote vaccinations, but also to understand what we're trying to prevent, and actually the potential diseases that they can get can be so serious. So
right. Now sometimes kids nowadays as well, and I'm talking about very small kids between the ages of 0 to 2, do get a recurrent fever and coughs and colds. And yes, we have discussed about cough and colds, but fevers as well. And sometimes we give, being a parent, you give them paracetamol or Calpol or something like that. But what is the fever? What is the alarming fever which as parents you need to be worried about, or take your child to seek advice or help?
Okay, so there's I think there's two things that as a parent we should be guided by. One is obviously what is a fever, what is that number that we look for. And to be honest with you, I think the second point is even more important, is how is my child? I know my child, how they normally behave. Are they behaving differently? Are they sicker than normal? Are they more tired than normal? Are they not eating? Are they having lots of dry nappies because they're not passing urine? Are they not drinking? Are they complaining of pain anywhere else? So those are very important signs. And although we would say to you that a temperature above 38 is significant, I would be more interested also is how's the child? Have they got anything else? Have they got a rash? And actually be guided more by that. Obviously, if the child's well and they don't have any of the other problems, a temperature is distressing in itself, and initially you can use Calpol. But after 24 hours, if you're using Calpol and the child's still not getting better, then you should actually get them seen by their GP. And obviously in the weekends, if your GP is not open, please do contact 111 to seek further help.
Now,
so we do know that many children have feverish illnesses, and in the vast majority, these are minor viral illnesses. We do actually recognise that the 0 to 3 month age group, we do get more concerned if a child has a fever and we don't know where it's coming from. And in a very small baby, we'd certainly be worried about any fever that's associated with the child not feeding well, being irritable, and appearing particularly unwell, and particularly if the fever's above 38. 38. We allow older children, we know that actually if they're not very unwell, that if there are no other associated signs, we may not worry with an illness that puts your temperature up between up to perhaps 39. But actually the secret there, the most important thing there, is to look at the child and the temperature and how that child is behaving, and do seek help if your child appears to be deteriorating, isn't able to feed, isn't having wet nappies, or is much more lethargic than usual. We know that giving them paracetamol may not actually change the illness in itself, but what it does do is allow the child or the baby to feel much more comfortable, and then you can actually see how unwell they are, because often a child will settle down and really obviously not be too poorly once their temperature has come down for a while.
Now, sometimes, as you have said earlier, that these illnesses also create immunity within the child. So, by giving these kind of medication, do we somehow weak the immunity, or somehow what are we? Because sometimes the immunity which child is building up due to these illnesses, we give them the medication. Will it affect their immunity in any way, shape or form?
Okay, so if we're talking about things like Calpol, no, it doesn't affect their immunity. What we're trying to do, as my colleague sort of explained, Beryl, was it's making them feel more comfortable. And obviously it's quite distressing. I mean, you and I have probably had a flu and had that high fever and you just feel absolutely terrible. But when your temperature comes down, you just feel better. So that doesn't necessarily affect your immunity. But things like antibiotics are a little bit different. And when your GP or when you see your GP and they don't give you the antibiotics that you were so hoping for, because you were hoping that antibiotics would be sort of the magic cure to make your child better. There is a reason why we don't give antibiotics for children who don't need it, and that's for anybody, not just children, but especially children where we're finding that the resistance to antibiotics is increasing. So we all obviously want to give it to the children who are needing it and unwell and needing specifically an antibiotic. And if they don't need it, it's much better. Otherwise, you run the risk of causing side effects such as diarrhea and them just being unwell with it.
So I would agree that for simple viral illnesses, antibiotics actually don't make a child better. Sometimes parents do think antibiotics have made the child better when the child would have got better without medication. We do need to give antibiotics to a child who appears to be very ill and deteriorating, and we need to be confident that the antibiotics will work in that situation. And if they're used repeatedly for viral infections, I would agree with Anita that we run the risk of antibiotic resistance. So it's good not to use antibiotics when you don't need them, but to use them if you have a child who may have a serious infection. And to identify that, the GPs and the health professionals and the paediatricians are skilled at looking at children to identify signs of infection, but also we also identify a very small number of children who do have long-term conditions that might make them more prone to bacterial infections than others, and who are higher risk. And in that group, we do give antibiotics at an earlier stage in illness, but it's so important to avoid using them when they're not necessary.
Perfect. Okay. Now a question just popped up on my screen. It says, how to develop an eating habit, how to develop a healthy eating habit in my son who's 4 years old and he is not good in eating at all.
Okay. I mean, it's an interesting topic, isn't it? Because we're always promoting everywhere about good, healthy living, and that's both through your diet and obviously through exercise and so forth. I think one of the things I would look at is how does the family eat as a whole, because obviously children role model very much their family, their parents, or whoever is around them. So it's looking at their eating habits. It would be quite interesting to know from our listener kind of what things they do like. I mean, I know my children absolutely love chocolate, but I know that's a treat, and it's about how you control what they like. Those special treats we know that are a little bit naughty, but they've got to have a healthy, balanced diet. And if it's a case that actually knowing what to give them and how to create a plan for them, again, your health visitor is excellent. There's a lot of health promotion out there, and not just through the health visitors, but at the children's centres, they do classes specifically to look at, healthy living kind of foods. So snacks like cucumbers, carrots, finger food, which children at that age really enjoy. So it's a much more kind of a fun process. They're very good at guiding them for that. But don't look at the child, look at also yourself, because you all want to be a healthy family. And although we have a duty to our child, we also have a duty to ourselves to be healthy.
A few thoughts to add. I entirely agree with everything Anita said. One is that eat as a family as much as possible, which is really useful. Even when your children are small, it's great if they can eat in company. Children of school age often enjoy eating with their own peer group on small tables and chairs, and that can encourage things. Don't force food. If you feel that your child's not eating enough, sometimes parents are so anxious that meal times can become quite an anxious time, and do try and avoid that. Don't always give your children chocolates and sweets after, or things to fill them up if you think they haven't eaten enough, because that will encourage snacking rather than having a meal. And actually involve your children when you go shopping about choosing food, and even simple helping you prepare food, because then they're often more interested in eating.
I think making it fun, really.
And that's the age where it's you do not have a child health visitor, because between the ages of 3 and 5 is the age where mostly childs do not have health visitor, or they do not go to health centres, and the school nurses are not there because they are not enrolled in school.
And do avoid lots of sugary drinks, because sugary drinks will often make children feel rather full, and they're less likely to eat well at meal times, and obviously they're not good for future health or for their teeth.
I think one of the things I found quite helpful with my children was actually making chapati, and the fact that they got to roll it out and they were part of that making, or a pizza base, or you could do pasta, because if they feel that they're part of that creation, they're a little bit more interested in tasting a bit. So although it can be a bit of an uphill struggle, you feel as a parent, if you can make it a little fun for them, and don't get too fixated and too rigid on certain plans, I think you will find that naturally you can slowly go towards healthy living really with them.
Perfect. Another question just popped up on the screen. Well, it was there for quite some time, but we will keep going on our pace. It says, mine 4 years become hyper in serving a severe condition and demands some which she wants. Maybe it's late night, or a few minutes later, suddenly she becomes normal. Please tell us about it. I think so. What our listeners meant is that she becomes hyper and then she becomes normal. So is it quite common between being hyper and normal fluctuations during that age limit?
I think we probably need a little bit more information. So obviously, children who are extremely tired, well, anybody, I think, who's very, very tired, but especially at night, if my children don't go to bed, at a certain time, they will literally have this rebound of energy and start running around and so forth, and then become tired because they've obviously run around and tired themselves out. So I think in that context, if it's in that context where it's been a late night and so forth, and routine is actually quite important. As long as routine in a sort of a relaxed way, but routine is quite important for children. They do need a lot more sleep than we realise, so maybe that's a factor. One of the things Beryl was pointing out was actually fizzy drinks, sweet drinks, especially near the evening. I would definitely not recommend it. It does make them far more active, and that's really the time that you want them to sort of start calming down. So making a routine in the evening, if this is an issue, do in the evening. So creating that routine that to calm them down, having a time that they can rest, have reading time, and then get them to bed on time probably will help them. Otherwise, what they do is get hyper and then they tire themselves out.
One of the common things which most of us see in our society is the developmental delays between in childs between the ages of 3 and 5. Is it quite normal, or is it something which fluctuates with the different environment or age band or ethnicity?
Development is very individual, and obviously we talk about children having milestones and ages when we expect them to do certain things. But what we need to know is that every child is an individual, and there may be very normal children who do things at very different ages. For example, some children will walk early at say 9 or 10 months. Other quite normal children won't be walking until they're 18 months, and that doesn't necessarily mean that they've got a problem. But this is where the family centres are a good place to go, where the health visitor will actually also see children and assess them and see whether they actually are concerned about the child. So although children do things at a different pace, there are a small number of children who do have significant developmental delay. The health visitors and the GPs are very good at spotting those and will then ask a paediatrician, often a community paediatrician at a developmental centre, to have a good look at a child. Or sometimes when we see a child for another health problem, we just become aware that we're not quite comfortable with the way a child's developing, and then those children need to be looked up a little bit further. But the most important thing about development is not what your child is doing now, but how your child progresses over a period of time when we actually look at them and see whether they've actually learnt new skills. And that's something that can be monitored, and then when there are worries, the child will be seen by experts.
And I must say, wow, the time has passed extremely quickly, because we just have 2 minutes to finish our show, and I just I have a list of questions in front of me which I wanted to ask you. One of the questions which I do want to know is about hand, foot, mouth disease, which is often quite common during the school ages. So is it something for parents to worry about? I just need your quick thoughts on about.
Okay, so I think quick messages on that. It presents in different ways, so sometimes it can be very difficult to recognise. It can present with just a bit of a fever at the beginning, and then you can get a few spots on your hands, on your lips, on your feet. The critical factors about it is obviously it is contagious, so you do need to get your child off school when they do have it, and as the spots crust over, just like chickenpox, it's fine. The other thing is obviously if it's around their mouth, make sure that their feeding is okay, because that's really important. It can get quite sore, so keep on top of their liquids and hydration.
Wow. Thank you so much. Thank you so much, ladies, for coming in for our show tonight. And thank you so much for enlightening us with all your expertise. I must say, it is there are still some questions remaining which came from our lovely audience. And I'm so sorry, audience, we have not able to cover all your questions which popped up on the screen. But we try our level best to cover much part of it. If you missed any part of this show, please go. You can hear our show on our podcast by going on to www.inspirefm.org and go to the website program listing, and you can think about that. Tomorrow we will be covering another topic as a part of Friday Night Live. Until tomorrow, I'm your host Fahad Matin. Assalamu alaikum.